This is the recording on assessment and management of patients with vascular disorders and problems of peripheral circulation. We don't have learning objectives in this particular module, so I would say that you definitely want to understand the anatomy and physiology involved in all of these different disorders that we're going to go over, and understand them from a nursing perspective. So it's a great time to get out your condition concept map and maybe start using it as we work our way through this. The vascular system, also called the circulatory system, is made up of the vessels that carry blood and lymph through the body. The circulatory system pumps blood from the heart to the lungs to get oxygen. The heart then sends oxygenated blood through arteries to the rest of the body. The veins carry oxygen-poor blood back to the heart to start the circulation process over again. Your circulatory system is critical to healthy organs, muscles, and tissues. The vessels of the circulatory blood system are arteries, which are blood vessels that carry oxygenated blood away from the heart to the body. Veins, blood vessels that carry blood from the body back to the heart. Capillaries, which are tiny blood vessels between arteries and veins that distribute oxygen-rich blood to the body. The blood moves through the circulatory system as a result of being pumped out of the heart. Blood leaves the heart through the arteries, and that blood is saturated with oxygen. The arteries break down into smaller and smaller branches to bring oxygen and other nutrients to the cells of the body's tissues and organs. As blood moves through the capillaries, the oxygen and other nutrients move out into the cells, and waste matter from the cells moves into the capillaries. As the blood leaves the capillaries, it moves through the veins, which become larger and larger to carry the blood back to the heart. In addition to circulating blood and lymph throughout the body, the vascular system functions as an important component of other body systems. Examples include the respiratory system. As blood flows through the capillaries in the lungs, carbon dioxide is given up and oxygen is picked up. The carbon dioxide is expelled from the body through the lungs, and the oxygen is taken to the body tissues by the blood. The digestive system. As food is digested, blood flows through the intestinal capillaries and picks up nutrients such as glucose, vitamins, and minerals. These nutrients are delivered to the body tissues by the blood. Kidneys and urinary system. Waste materials from the body tissues are filtered out from the blood as it flows through the kidneys. The waste material then leaves the body in the form of urine. Temperature control. Regulation of the body's temperature is assisted by the flow of blood among the different parts of the body. Heat is produced by the body's tissues as they go through the processes of breaking down nutrients for energy, making new tissue, and giving up waste matter. I want to say one more thing. Remember that your arteries carry oxygen-rich blood and your veins carry oxygen-poor blood, with the exception of the pulmonary artery carries deoxygenated blood to the lungs, and the pulmonary vein carries oxygen-rich blood back to the heart. That's the only exception to the rule. Heart failure is a clinical syndrome characterized by typical symptoms. Those are usually dyspnea, perhaps ankle swelling, and fatigue. They may be accompanied by signs such as jugular vein distension, pulmonary crackles, which is the fluid in the lungs, and peripheral edema. And heart failure is caused by a structural and/or functional cardiac abnormality, leading to a reduced cardiac output and/or elevated intracardiac pressures at rest or during stress. A vascular disease is a condition that affects the arteries and veins. Most often, vascular disease affects blood flow, either by blocking or weakening blood vessels, or by damaging the valves that are found in the veins. Organs and other body structures may be damaged by vascular disease as a result of decreased or completely blocked blood flow. What causes vascular disease? One is atherosclerosis. This is a buildup of plaque, which is a deposit of fatty substances, cholesterol, cellular waste products, calcium, and fibrin in the inner lining of an artery. It is the most common cause of vascular disease. It is unknown exactly how atherosclerosis starts or what causes it. It is a slow, progressive disease that may start as early as childhood. However, the disease has the potential to progress rapidly. It is generally characterized by the buildup of fatty deposits along the innermost layer of the arteries. If the disease process progresses, plaque may form. This thickening narrows the arteries and can decrease blood flow or completely block the flow of blood to organs and other body tissues and structures. And I'm just going to add here that you can think of this disease almost like a house that is old. The plumbing gets old. So all of the products and the hard water minerals and all the stuff that comes out of our sinks and goes down into our drains. So think of your sink as the heart and the drains as your arteries. Over time, you can get blockages in your plumbing and you have to call the plumber. So our cardiovascular doctors, they're the plumbers, and they're going to come in and they're going to look for where those problems are in your vessels. And they may fix them by putting in stents to open up the vessels. Or if that does not work and they can't reach it or it's collapsing and it's not effective, then that's when we're looking at doing bypasses. Blood clots. A blood vessel may be blocked by an embolus, which is a tiny mass of debris that moves throughout the bloodstream, or a thrombus, which is a blood clot. Inflammation. In general, inflammation of blood vessels is referred to as vasculitis, which includes a range of disorders. Inflammation may lead to narrowing and blockage of blood vessels. Trauma or injury involves the blood vessels, or trauma or injury involving the blood vessels may lead to inflammation or infection, which can cause damage to the blood vessels and lead to narrowing and blockage. Genetic. Certain conditions of the vascular system are inherited. What are the effects of the vascular system? Because the functions of the blood vessels include supplying all organs and tissues of the body with oxygen and nutrients, removal of waste products, fluid balance, and other functions, conditions that affect the vascular system may affect the parts of the body supplied by a particular vascular network, such as the coronary arteries of the heart. So the symptoms of your person are going to depend on which arteries are affected. Examples of the effects of vascular disease include coronary artery disease, which would be heart attacks, or what we call a myocardial infarction, an MI, or angina, which is chest pain. That is angina, which is caused by a decreased flow of blood that is not providing enough oxygen in that moment. That's angina. Cerebral vascular disease. That includes strokes, transient ischemic attacks, or TIAs, which is a sudden or temporary loss of blood flow to an area of the brain. And it usually lasts less than 5 minutes, but resolves no longer than 24 hours with complete recovery. That's a TIA, or a transient ischemic attack. It's a temporary loss of blood flow, causing symptoms that last no longer than 24 hours, as opposed to a stroke, which can have long-lasting, it's the #1 cause of disability, I believe, in the United States, and it is happening to people at younger and younger ages. Peripheral vascular disease. Claudication is where you're walking around and all of a sudden you're limping because you have pain in your calf or in your thigh or in your buttocks, and you have a hard time walking very far. And that is because those vessels in the peripheral arteries are not carrying the blood effectively. So it's causing pain. That pain is due to the lack of oxygen. Critical limb ischemia, and that is a lack of oxygen to the limb or the leg at rest. Because vascular conditions and diseases may involve more than one of the body's systems at a time, many types of doctors treat vascular problems. Specialists in vascular medicine and or surgery work closely with doctors in other specialties, such as internal medicine, interventional radiology, cardiology, and others, to ensure comprehensive care of patients with vascular conditions. The pulmonary circulation moves blood between the heart and the lungs. It transports deoxygenated blood to the lungs to absorb oxygen and to release carbon dioxide. The oxygenated blood then flows back to the heart. Systemic circulation moves blood between the heart and the rest of the body. Age-related changes in the blood vessels. Again, always know your age-related changes for your geriatric population, please. The aorta becomes thicker, stiffer, and less flexible. This is related to changes in the connective tissue of the blood vessel wall. This makes the blood pressure higher because it has more resistance, and it makes the heart work harder. There's an increase in peripheral resistance, increased impaired blood flow, increased left ventricular workload. Remember, the left ventricle is the pump that pumps the blood to the body. And this can lead to hypertrophy of the myocardium, so enlarged muscles in the myocardium. Aging and hypertension. Persistently elevated blood pressure in the arteries associated with the development of disorders such as atherosclerosis that we just discussed, a heart attack or an MI, and stroke. And it can cause kidney damage. There is a decrease in compliance with age due to a loss of elasticity, notably with the aorta. The physical examination of the cardiovascular system involves the interpretation of vital signs, inspection, palpation, and auscultation of heart sounds as the nurse evaluates for sufficient perfusion, pulses, and cardiac output. A health history is then done to assess any history of intermittent claudication, pain at rest, locations of the pain, and many other questions that go into assessing the cardiovascular system. The cardiac examination consists of evaluation of the carotid artery, arteries, I should say, and auscultation for carotid bruit. The jugular venous pulse and auscultation for cervical venous hums. The precordial impulses and palpation for heart sounds and murmurs. Auscultation of the heart. Physical assessment includes looking at the color of the skin, feeling the temperature of the skin, noting pallor, if there's any hair loss, are the nails brittle, is the skin dry, any ulcers, any atrophy of tissue. A peripheral pulse refers to palpating the high pressure wave of blood moving away from the heart through vessels in the extremities following systolic ejection. This phenomenon is often readily palpated and serves as a useful clinical tool, comprising one of the most commonly performed physical examinations. Palpation occurs at various locations of the upper and lower extremities, including the radial, brachial, femoral, popliteal, posterior tibial, and dorsalis pedis arteries, and most commonly evaluates the rate, rhythm, intensity, and symmetry. Remember symmetry. When we did our head-to-toe assessments, we said the radial pulses are strong and equal bilaterally +2. That's a normal finding. Peripheral pulses can be used to identify many different types of pathology. Finally, modern medical technology allows for further evaluation of pulses beyond palpation, using such tools as a Doppler ultrasound to characterize the pulse waveform. And I will add here that if you have a patient who has vascular disease and they're getting ready to have surgery, a lot of times it's very difficult to find their pedal pulses, which is what this patient in picture B is feeling. The popliteal is A, C is the posterior tibial. But B, it's hard to find those pulses. Once you locate them, even if it's with the Doppler, take a Sharpie and mark where you found them, because it's imperative that we as nurses after a surgery are continually monitoring those pulses to make sure that they're not becoming occluded, which would be a surgical emergency potentially. Doppler flow is a type of ultrasound that uses sound waves to measure the flow of blood through a blood vessel. Waveforms of the blood flow are shown on the ultrasound screen. Doppler flow studies may be used to assess blood flow in the umbilical vein and arteries, fetal brain, fetal heart, and many other organs. The ankle brachial index, or ABI, is a simple test that compares the blood pressure in the upper and lower limbs. Healthcare providers calculate ABI by dividing the blood pressure in an artery of the ankle by the blood pressure of an artery of the arm. This test helps diagnose patients who have PAD, peripheral arterial disease. Cardiopulmonary exercise testing, or CPET, has become an important clinical tool to evaluate exercise capacity and predict outcome in patients with heart failure and other cardiac conditions. CPET involves measurements of respiratory oxygen uptake, or VO2, carbon dioxide production, VCO2, and ventilatory measures during a symptom-limited exercise test. Duplex ultrasound involves using high-frequency sound waves to look at the speed of blood flow and structure of the leg veins. A computerized tomography, or a CT scan, combines a series of X-ray images taken from different angles around your body and uses computer processing to create cross-sectional images or slices of the bones, blood vessels, and soft tissues inside your body. CT scan images provide more detailed information than plain X-rays. Angiography, or arteriography, is a medical imaging technique used to visualize the inside or the lumen of blood vessels and organs of the body, with particular interest in the arteries, veins, and the heart chambers. They can be highlighted further by using a contrast dye. Phlebography, or varicography is a radiological procedure for direct imaging of venous vessels. So phleb is, we have phlebotomists that draw blood from the veins, and then varicose. Remember those two, they're both related to vein. It's a radiology procedure to look at the venous vessels. In this procedure, iodine-containing X-ray contrast medium is directly injected into the venous vascular system via a venous puncture. Wow. Lymphoscintigraphy is a special type of nuclear med imaging that provides special pictures of the lymphatic system, which transports fluid throughout your immune system. This test is often used to identify the sentinel lymph node or the first node to receive the lymph drainage from a tumor. Now we're going to talk about assessment of the patient with peripheral vascular issues. PVD, or peripheral vascular disease, also known as peripheral artery disease, PAD, is a condition characterized by slow and progressive narrowing of the arteries of the extremities. This condition stems from structural damage in the blood vessels, often caused by atherosclerosis. Additional risk factors include diabetes. Again, we've talked about why that would be. Hypertension, hyperlipidemia, which is high cholesterol, obesity, smoking, increasing age over 50 years old, and there's one more, and I thought of it, and it's not on this list. So let me think about that for a second. I'm just going to add sedentary lifestyle to that. PVD can lead to gangrene and limb amputation in the affected extremity if left untreated. Other complications of peripheral vascular disease include blood clots, kidney failure, and a heightened risk of death from heart attack and stroke. Clinical manifestations of peripheral vascular disease will depend on the location and extent of the blockage. Intermittent claudication is the classic sign of lower extremity PVD, which is described as an ischemic muscle pain that occurs during exercise and resolves with rest. And that is claudication. Other manifestations include paresias, so you get like the pins and needles, or you're just sitting down and your legs are falling asleep. Thin, shiny, and taut skin appearance. So your skin is thin, shiny, and tight. Decreased peripheral pulses. I mentioned that sometimes it's hard to find the pulses in those patients with this disease, and definitely if you have to use a Doppler, you want to mark where those pulses were so that the next person, or even you later in the day, can come back and listen for them again and see if they've changed. Pallor, so pale in color. Reactive hyperemia. Medical history and physical examination are important in diagnosing peripheral vascular disease. Additionally, tests like Doppler ultrasound studies, segmental blood pressures, ankle brachial index, duplex imaging, angiography, and magnetic resonance angiography aid in diagnosing peripheral vascular disease. Continual assessment for the risk factors, signs and symptoms of arterial insufficiency, claudication, and rest pain, skin color changes, weak or absent pulses, skin changes, and skin breakdown. The goals for the patient with peripheral vascular problems, we want to improve peripheral blood flow, improve oxygen delivery to affected limbs, alleviate pain, alleviate any symptoms of intermittent claudication, prevent complications such as non-healing ulcers or infections, decrease venous congestion, prevent vascular compression, promote vasodilation, and maintain tissue integrity. The goals for peripheral artery disease are manage the symptoms such as leg pain so exercise isn't uncomfortable. Improve artery health to reduce the risk of heart attack and stroke. Treatments for peripheral artery disease include lifestyle changes and sometimes medication. Lifestyle changes can help improve symptoms, especially early in the course of peripheral artery disease. If a patient smokes, quitting is the single most important thing that can be done to reduce the risk of complications. Walking or doing some other exercise on a regular scheduled basis can improve symptoms dramatically. It needs to be a supervised exercising program and approved by the patient's doctor. If peripheral vascular disease is causing symptoms, providers may prescribe medication. Medications for peripheral arterial disease may include cholesterol medications, which are called statins. They are commonly prescribed for people with PAD. The statins help lower bad cholesterol and reduce plaque buildup in the arteries. The drugs also lower the risk of heart attacks and strokes. Blood pressure drugs. Uncontrolled high blood pressure can make arteries stiff and hard. This can slow the flow of blood. Medications to control blood sugar. If the patient has diabetes, controlling blood sugar levels becomes even more important. Medications to prevent blood clots. Peripheral artery disease is related to reduced blood flow to the limbs. So medicines may be given to improve blood flow. Aspirin or other medication, such as clopidogrel, which is Plavix, may be used to prevent blood clotting as well. I'm not going to say this drug name right. The drug silostazol, maybe that's how you say it, thins the blood and widens blood vessels. It increases blood flow to the limbs. The drug specifically helps treat leg pain in people who have peripheral artery disease. So far, that's the only medication that was specific to that disease. The other things are going to help to treat the symptoms of the disease. Positioning strategies. Elevating your legs while sleeping can help to alleviate the discomfort of peripheral arterial disease. Raising the legs slightly above the heart level prevents blood from pooling in the extremities. When blood collects or pools in the leg, it can cause significant swelling and discomfort. Moreover, any elevation allows gravity to take its course, and it helps to return the blood from the legs and back towards the heart. Exercise program and activities include walking, graded isometric exercises, but patients should consult primary provider before they engage in an exercise routine, as I mentioned. And given that cold temperature causes constriction of the small arteries and veins in the skin, patients who suffer from peripheral circulation problems like peripheral vascular disease may be vulnerable to cold injuries. And since blood vessels tend to also spasm in cold weather, peripheral artery disease symptoms often worsen in winter. Discourage the use of nicotine and learn stress reduction and management techniques. Arterial disorders. Arterial sclerosis is hardening of the arteries. Okay, I don't need to read you this because you can read. So read that slide. And then here's your progression. All these things that can happen because of this buildup in the arteries. Atherosclerosis develops progressively through continuous evolution of arterial wall lesions centered on the accumulation of cholesterol-rich lipids and the accompanying inflammatory response, endothelial damage, and immune response. Atherosclerosis begins with endothelial damage. A fatty streak is the first visible sign of atherosclerosis. Then you have plaque growth. Plaque rupture or erosion, hemorrhage, ulceration, thrombosis, that all leads to MIs, CVAs. It can lead to gangrene. On this sheet, you have your modifiable and your non-modifiable risk factors. So don't smoke, control your blood sugar, control your high blood pressure, control your cholesterol. Eat a heart-healthy diet, reduce the stress, exercise, keep an eye on your C-reactive protein, which shows inflammation in the body, and hyperhomocystinemia. Homocysteine is a chemical. I lost my place because I had to stop and go, wait, what is that? Homocystinemia. All that was referring to is it is a blood test that we do. And if homocysteine is elevated in the blood, it is a predictor for heart disease, but it is controllable, so we keep an eye on it and hope that it goes down through treatment. Non-modifiable risk factors are increasing age and a family predisposition to atherosclerosis and peripheral arterial disease. Okay, peripheral arterial disease, also called peripheral artery disease, also called peripheral arterial disease, is a common condition in which narrowed arteries reduce blood flow to the arms or legs. In peripheral artery disease, the legs or arms, usually the legs, don't receive enough blood flow to keep up with demand. This may cause leg pain when walking, claudication, and other symptoms. Peripheral artery disease is usually a buildup of fatty deposits in the arteries, atherosclerosis. Atherosclerosis causes narrowing of the arteries that can reduce blood flow in the legs and sometimes the arms. I feel like this is repeating itself on all these slides. This slide lists the common sites of atherosclerotic obstructions in the body. That's a lot of places, a lot. Okay. The commonly used medications for PAD are antiplatelet medication, aspirin, and inhibitors of various platelet surface receptors, including P2Y12, clopidogrel, which is also known as Plavix. Statins, commonly prescribed as atorvastatin. It blocks the enzyme needed to make cholesterol. So you're thinning out the blood and you're blocking the ability to make cholesterol. They should be taken at bedtime so that the drug molecules can bind to these enzymes, which are more active at night. We should assess for worsening leg pain, especially in the thighs. It's important, too, that we do liver labs at least twice a year. Chronic venous insufficiency can develop from common conditions such as varicose veins. It can also occur if something such as a deep vein thrombosis, DVT, or other clot damages the valves inside the veins. Over time, as the veins become increasingly weak, they have more trouble sending blood to the heart. Chronic vein insufficiency damages those valves, causing blood to pool in your legs. This increases pressure in your leg veins and causes symptoms like swelling and ulcers. CVI can happen due to damage in any of your leg veins. These include your deep veins, which are large veins deep in the body that run through the muscle, superficial veins, which are close to the skin's surface, perforating veins, which connect the deep and superficial veins. These burst capillaries can cause tissue inflammation in that area, tissue damage, venous stasis ulcers. These are open sores on your skin's surface. Venous stasis ulcers don't heal easily and they can become infected. The infection could spread to nearby tissue. This condition is known as cellulitis, which is dangerous if not treated right away. Causes of valve malfunction may be congenital, primary, or secondary. Congenital, those are malformations in your leg veins that you're born with. For example, some people are born without valves in their leg veins. Primary causes are any changes to your leg veins that prevent them from working as they should. For example, your vein may get too wide, preventing its valve from closing all the way. Secondary causes are other medical issues that damage your leg veins. Deep vein thrombosis is usually the culprit in this case. The thrombus leaves behind scar tissue that damages the valve. Venous thromboembolism is a term referring to blood clots in the veins, and it is underdiagnosed, serious, and yet a preventable medical condition, but it can cause disability and death. DVT is a medical condition that occurs when a blood clot forms in a deep vein. These clots usually develop in the lower leg, thigh, or pelvis, but they can also occur in the arm. It is important to know about DVT because it can happen to anybody, and it can cause serious illness, disability, and in some cases death. The good news is that DVT is preventable and treatable if it's discovered early. So these are your most serious complications of DVT or deep vein thrombosis. The most serious complication happens when a part of the clot breaks off and travels through the bloodstream to the lungs, causing a blockage called a pulmonary embolism. If the clot is small and with appropriate treatment, people can recover from a pulmonary embolism. However, there could be some damage to the lungs. If the clot is large, it can stop blood from reaching the lungs, and it's fatal. About 1/3 to 1/2 of those who have a DVT will have long-term complications caused by the damage the clot does to the valves in the vein, called post-thrombotic syndrome, or PTS. People with PTS have symptoms such as swelling, pain, discoloration, and in severe cases, scaling or ulcers in the affected part of the body. In some cases, the symptoms can be so severe that a person becomes disabled. For some people, DVT and PEs can become a chronic illness, and about 30% of people who have had a DVT or a PE are at risk for another episode. So here's your risk factors for DVT. Almost anyone can have one. However, certain factors can increase the chance of having this condition. The chances increase even more for someone who has more than one of these risk factors at the same time. So here they are. Injury to a vein. And this can be caused by fractures, severe muscle injury, or major surgery, particularly involving the abdomen, pelvis, hip, or legs. So I just want to say in this case, my son broke his femur when he was in 3rd grade, I think. And the complication that the surgeon explained to us is that he could have a fatty embolism break off, which can cause an embolism as well. So pieces of fat can break off as well as having a blood clot. Slow blood flow, often caused by confinement in bed. So that is a huge reason for getting a DVT, which is why we do DVT or VTE prophylaxis in the hospital. We give our patients typically heparin injections because they only last about 8 hours. They have a short half-life. So if we end up having to do a medical procedure, we don't have to wait very long to do that. Limited movement, like a cast on a leg. Sitting for a long period of time, especially with crossed legs, or someone who has paralysis. Increased estrogen, often caused by birth control pills, hormone replacement therapy, and sometimes they're used after menopause too. Pregnancy for up to 3 months after giving birth. Certain chronic medical illnesses such as heart disease, lung disease, cancer and its treatment, inflammatory bowel disease such as Crohn's or ulcerative colitis. Other factors that increase the risk include previous DVT or PE, family history of DVT or PE, age. Your risk increases as age increases. Obesity, a catheter located in the central vein. So like if you put in a central line to be used by a patient, sometimes those patients will develop a DVT distal to that catheter placement, usually in that arm. Inherited clotting disorders as well. The following tips can prevent a DVT. Early ambulation as soon as possible after having been confined to bed, such as after surgery, illness, or injury. This is why we have to get our patients up and they need to ambulate or at least get up to a chair the day of surgery. Graduated compression stockings. SCDs, or sequential compression devices. These are devices that are hooked up to a machine. You put this wrap that velcros on the bottom portion of the calves, and when you turn the machine on, it's basically massaging your calves and pushing and helping the blood flow from the calves back to the heart, so it's not pooling. We do that a lot in the hospital as well, and sometimes we'll do it along with heparin or because the patient can't have heparin. Then we also use medications There's the heparin or Lovenox anticoagulants to prevent a DVT. When you're sitting for long periods of time, such as when you're traveling for more than 4 hours, get up and walk around every 1 to 2 hours. Exercise your legs while you're sitting, and I've done this. You can raise and lower your heels while keeping your toes on the floor. Raise and lower your toes while keeping your heels on the floor. Tightening and releasing your leg muscles. Another thing that I do is I write the alphabet in the air with my feet. I know it looks silly, but I don't care. I'm old and I don't care what people think. I don't want a DVT. Wear loose fitting clothes. You can reduce your risk by maintaining a healthy weight, avoiding a sedentary lifestyle, smoking cessation, and regular exercise, just like everything else, I feel like. These are important diabetic foot care orders that should be followed. Pause the video, read through them, and take ample notes. Another thing that's not on here is if you do cut your toenails yourself, always cut them straight across, never curved. Assessment of the patient with leg ulcers includes a history. Do they have a history of these ulcers? What's their other health history and physical assessment information? Do they have leg pain or tenderness in their thigh or calf areas? Is there any swelling in the legs? Edema. Does their skin feel warm to the touch? Are there reddish discoloration of the skin, especially in the calf area, or red streaks? Assess their peripheral pulses. And many times, if your patient has leg ulcers, their legs will be that brown or red color, and they will have really difficult to palpate pulses that you may have to use the Doppler for. And if you do find them, they're usually weak and thready. Pulmonary embolism can be fatal, and it occurs when the DVT breaks free from a vein and blocks some or all of the blood flow to the lungs, causing unexplained shortness of breath, rapid breathing, chest pain, anywhere under the rib cage, and it may be worse with deep breathing. A fast heart rate, because the heart is compensating for that lack of oxygen, lightheadedness or passing out. Assess for signs and symptoms of infection. Assess for nutritional status. So those are all the things that we as nurses need to do to assess our patients that have leg ulcers. So how are the leg ulcers treated? You know what? I feel like that's on the wrong script slide. That was all management of patient with leg ulcers, or with, yeah, this goes with that. Leg ulcers can be challenging to eliminate. So think about it. As we've said, if you don't have good circulation to the lower extremities, then it's going to be difficult to treat because it's going to be hard to get your antibiotics to the place where they need to be. It's going to be hard to get nutrients and minerals and oxygen to those areas because they have this condition that makes it difficult to carry it down there. So treatments vary depending on the ulcer type and the cause. The healthcare provider will focus on healing the wound, reducing swelling, and preventing the ulcer from coming back as it heals. We do a lot of compression therapy with stockings or bandages to stimulate blood flow to the legs. Leg elevation above the heart for 1 hour a day for at least 6 days. Wound care, including debridement of any dead tissue. Topical antiseptics to prevent infection, and regular bandage changes. Antibiotics to treat infections when needed, and medications to open blood vessels and improve blood flow, vasodilators. Hyperbaric oxygen therapy to get more oxygen in the blood and speed up the healing process. Sclerotherapy or endovascular ablation to treat varicose veins. Surgery to remove, repair, replace, or bypass the damaged vein. Skin grafts for wounds larger than 4 inches or ulcers that don't heal with other treatments. This has 2 talking points here. I feel like that's self-explanatory. Know your signs and symptoms of infection and what you're looking for. Gangrene is severe infection, and it's not going to heal because of the lack of blood flow. The tissue is dying. It's turning black. It's probably going to end up with an amputation. These are some different examples of lower extremity ulcers. Note and know the features and the differentiators of all of these different types of ulcers. You have venous ulcers, arterial, neuropathic or diabetic, and then pressure. I would suggest making some note cards or study aids for this. Maybe print this slide out in color and take the pictures, make your little note cards, make sure that you know that slide. So our interventions for our patients with leg ulcers include cleansing the wound, positioning, avoiding trauma, avoid heat sources. Get them up. Initially, we don't have them get up because we're trying to promote healing, but we want to gradually progress their activity. The activity will help promote the blood flow and encourage the patients to move about in bed. They can exercise their upper extremities. They can do stuff in bed. I bought my parents' videos, and when they moved out here, I found them not even opened. They were still wrapped up, which I get. But it was chair exercises using canned goods, just like a little, they don't have to be able to get up to be able to do some mobility exercises. Analgesic agents before scheduled activities to control their pain. And then promoting adequate nutrition. You want to give them all the things we talked about for skin, healing any type of injury. That's protein, vitamin C and A, iron and zinc. Preventing varicose veins. You want to avoid activities that cause venous stasis. So don't wear socks that are too tight at the top or that leave marks on the skin. Don't cross the legs at the thighs. I do that all day long. Don't sit or stand for long periods. Elevate the legs 3 to 6 inches higher than your heart level. Encourage walking 30 minutes every day if there are no contraindications. Wear graduated compression stockings. Overweight patients should be encouraged to begin weight reduction plans. Lymphatic disorders. Lymphangitis is inflammation or infection of the lymphatic channels. Lymphadenitis is inflammation or infection of the lymph nodes. Lymphedema is tissue swelling related to obstruction of lymphatic flow. And that could be primary, which is congenital, you're born with it. Secondary, which is an acquired obstruction. Cellulitis is a deep infection of the skin caused by bacteria. Sorry. It usually affects the arms and legs, but it can develop anywhere. It can be around the eyes, the mouth, the anus, on the belly. Normal skin can be affected by cellulitis, but it usually happens after some type of injury causes a skin break, including trauma or surgery. Once the skin breaks, bacteria can enter and cause the infection. So what is cellulitis? It is usually caused when bacteria enters a wound or an area where there is no skin. The most common bacteria that causes cellulitis is hemolytic streptococcus, Streptococcus pneumoniae, Staphylococcus aureus. Staph and strep bacteria are commonly found on the skin and mucous membranes of the mouth and nose in healthy people. So think about it. If you have diabetes and you get an injury like an ulcer on your leg, everybody has these bacteria on their skin. I mean, even after we wash, we have it on our skin. So now that bacteria gets into that wound and it creates an infection because there's a break in the skin. And that's how it usually happens. Other causes may include human or animal bites or injuries that happen in water. So the signs and symptoms, they're pretty classic, I feel like. The skin is very red, there is swelling, and there is heat, and it hurts like crazy. And they have bruising, blisters, fever, headaches, chills, weakness, red streaks from the original site. Sometimes cellulitis can be an emergency. People can go septic with that. Patients should talk with a healthcare provider immediately if they notice any of the following: a very large area of red inflamed skin, a fever, and if the area affected is causing numbness, tingling, or other changes in a hand, arm, leg, or foot. If the skin appears black, that would be a problem. If the area that is red and swollen is around your eyes or behind the ears. And the symptoms can look like other skin conditions. So how do we diagnose it? It's usually based on a medical history and a physical exam. Blood and skin samples may be taken to confirm the diagnosis and the type of bacteria that's present. A bacterial culture can identify the organism causing the condition and indicate the most effective antibiotic. Getting treated right away can help prevent the spread of cellulitis, and the treatment can include oral, intramuscular, or IV antibiotics, cool, wet dressings on the infected site, keeping the area dry and clean, surgery. If your arm or leg is affected, elevating the arm or leg may help. Rest, time to heal, topical antibiotics, pain meds. And then based on the physical exam, the provider may admit the patient into the hospital, depending on the severity of the cellulitis. In the hospital, well, and I'll say not just depending on the severity of the cellulitis, but also depending on the other comorbidities the patient presents with. So if you have a patient who has cellulitis of the lower left extremity, uncontrolled diabetes, and heart disease, I think they're probably going to be in the hospital, or they very well could be. In the hospital, the patient will get antibiotics and fluids through an IV. And this now finally is the end of this chapter.